Hi, my name is Micah and I'm going to be your nurse today. I'm going to do a newborn assessment on your baby and I will go ahead and wash my hands and apply gloves. So I'll wash my hands and I'll put some gloves on. If you don't care, can you verify your birthday for me, and can you verify the name and date of birth for your baby as well? And so the mother will tell me her name and date of birth, the baby's name and date of birth, and then I will also look at their wristbands to make sure that they match and they're the same. So first I'm going to go ahead and unswaddle the baby. I'm going to just take a overall look at her. She's still clothed, so what I can see mostly is just her head, and so I can go ahead and start there at her head. So looking at her face, I'm just looking for any birthmarks or any signs of anything on her skin that needs to be noted. So we can start at the top of her head, and I do have gloves on. I'm looking at the top of her head at her fontanelles. So anterior and posterior, I want to make sure that they are still soft because they are. She is a newborn. With the fontanelles, you want to make sure that they're not bulging because that could be a sign of intracranial pressure. You want to make sure that they are not sunken in because that can be a sign of dehydration. You want to make sure that her hair is evenly, distributed or growing on her head. Palpate the suture line to make sure that that's okay. And next you're going to get to her eyes, and you're going to want to make sure that the sclera of her eyes is white and the conjunctiva of her eyes are pink. You're going to want to make sure that the corners of her eyes are equal to the pinna of her ears, because this can signify an underlying condition if they're not equal. Next, we'll go on to her nose, and along with respirations, we're going to make sure that her nose is not flaring, showing any signs of struggle to breathe. We're going to want to look and make sure that there's nothing in the nasal cavity that can cause any type of anything that can prevent her from being able to breathe well. That would need to be sectioned. We want to make sure down to her mouth that her lips are pink. They're not dry, they're not cracking, anything like that, and that they're moist. While we're focusing on her mouth, we can make sure that we have clean gloves on, and we can do with the one clean gloved finger, we can go ahead and try her or test her sucking reflex to make sure that that is working properly. So we will use a clean gloved finger and place it in her mouth. She should begin to suck on the finger, and then as we're pulling our finger out, we can graze the top of her mouth to make sure, the roof of her mouth, to make sure that the palate has formed completely there. We want to make sure that, once again, her mouth is very moist and not dry, because that can be a sign of dehydration. We can go on down to the chest area. To the clavicle, we want to make sure if the mother had any type of complications during delivery and the baby was to have had shoulder dysplasia or anything like that, we want to make sure we're very careful when assessing her clavicles. But for the clavicles, we're going to test her skin turgor to make sure that there's no other signs of dehydration. And her shirt would be off, and we would just assess her overall chest area, make sure there's no bruising, note any types of birthmarks or any skin markings there. While we're here, we can go ahead, since her shirt is off, this stethoscope does need to be on the patient's skin. For 1 full minute, we're going to listen to her apical pulse rate, and we're going to have a clean stethoscope just placed directly on her skin. And for 1 full minute, we're going to count that heart rate. After this, we can go ahead and assess her breath sounds. We're going to listen to both her right and left lungs, and we're going to listen in 5 different places. It's going to be the top lobe of the right, top of the left, middle of the right, bottom of the left, and then bottom of the right. And we're going to do the same thing on the back side. So we can go ahead and turn the baby over, And we'll listen to the same 5 places on the back side. Then we can flip her back over. As we're listening for breath sounds, we want to pay attention to make sure that the baby's chest is rising up and down equally. We want to make sure that we don't notice any type of nasal flaring. And we want to make sure that there's no retractions that could signify that she's struggling to breathe. While we have our stethoscope, we can go ahead and listen to bowel sounds as well. So all 4 quadrants, you're going to have the right and left upper and the right and left lower. You want to make sure that these are active, not hypoactive or hyperactive. And once we're finished with that, we can go ahead and look at her abdomen. We can palpate that to make sure that it's non-distended and non-tender. We're going to assess her umbilicus to make sure that she most likely will still have an umbilical cord attached to her belly button and we want to make sure that that is secured there and it has no signs of infection or inflammation, that there's no oozing of color, of discharge, no bleeding. We can go on to her arms. So here we can do a couple reflexes. Well, one reflex in particular, we can check her palmar reflex. So her palm would be out flat. We can stick our finger onto her palm here, and she should close her fingers around our hand. And we'll go ahead and back up and do some reflexes up on her face. So we have rooting. I would take my clean glove hand because we did the sucking reflex, but if I swipe her left cheek, she should turn her head to the left towards my finger, and that's the rooting reflex. So we'll go ahead and assess her legs, just kind of seeing if that causes any discomfort. We're not necessarily responsible for assessing for like hip dysplasia or anything like that, but that's more of the provider. But we do want to kind of go ahead and make sure that her legs it doesn't cause her any discomfort. While we're at her feet, we can make sure that her plantar reflex is working correctly, that we would place our finger almost like the palmar, but underneath her toes, and she should curl her toes around it. We have the Babinski reflex as well, where we would swap her foot and just swap our finger across her foot, and her toes should flare out. We have some more reflexes, but we don't want to get the baby crying, so we'll go ahead and move on, and we'll go ahead and assess her back. You're going to want to make sure that her spine is in alignment, it's straight, and there's no curvature to it. We want to assess the base of her spine to see if there are any dimples present or tufts of hair that could signify spina bifida or any further complications. We can go ahead at this point and take off her diaper, and right now is a good time to educate the mother about dirty diapers. She may be a first-time mom and she is not aware of these things, but we need to make sure that the mom knows that the baby should have 6 to 8 wet to dirty diapers a day. And we can go ahead and ask the mom if the patient has had her first bowel movement, and if the mother says yes, we can ask her what that bowel movement looked like. The mother should describe it as black and tarry, and that would signify that the patient has passed the meconium stool. So we'll go ahead and take her diaper off, and we'll assess. She is a female. At first glance, we'll go ahead and assess to see if there's any skin breakdown from the diapers, because this baby is new to diapers and to this brand, and they can have reactions to them. So we want to make sure that there's no redness or skin breakdown. Where she is a female, we're going to want to assess her labia, make sure that her majora is larger than her minora, and that they are present. We can go ahead and flip her to her backside. Keeping her diaper off, we want to make sure that there is no skin breakdown, no redness on her backside as well. And also assess and make sure that the anus is patent that it is there. So we would lay the baby back down and re-diaper her correctly, showing the mother if she does need teaching. Maybe she's never dressed a baby before or diapered a baby. So aside from this, there are a couple other reflexes as well, like the Morrow. She would most likely be in a crib type thing. Usually they're hard plastic, and we could go ahead and the baby should be laying kind of relaxed. If we bang on the sides just real quickly, it should startle the baby, and she would flare her arms out, flare her legs out, most likely give out some sort of cry, and that would allow us to assess her cry to see that if it's strong or weak, lustful, and we want to make sure that she does have that reaction. I believe that is all the reflexes, and I think that is everything. And so we can ask the mother, we need to take the baby's temperature as well. With a newborn, rather than checking with their ear or across their forehead, we're going to want to take it axillary underneath the patient's armpit. But it's very easy to, if we go in at an angle, the tip of the probe can be sticking out, so we want to make sure that it's parallel with the patient's body, and just kind of hold that arm down to hold that in place, and that way we get a good accurate reading. And we want the baby's temperature to be between 97.5 and 99.5. With the patient's heart rate too, I don't know if I mentioned this, but we want to make sure that the apical pulse is between 110 and 160 beats per minute. We're also listening for any murmurs, any abnormalities, tachycardia, bradycardia, anything like that, whenever we're listening to her apical pulse. Another thing we can do to assess to make sure that there's no dehydration is the capillary refills. I'm not sure if I mentioned that either. With the patient's all four extremities, we can check it at her fingertips to make sure that she has quick and brisk capillary refills. And I believe that's all. But other than that, we just want to make sure that there's no type of skin breakdown anywhere on her body, or make sure that any bruising or anything is noted in her chart. Lastly, we'll ask the mother if she would like to keep the baby in here with her, or if she would like for me to take her back to the nursery. So we can go ahead and swaddle her up because she asked to send her back to the nursery. So we'll go ahead and do that, and we can have the mother call us out whenever she wants her baby to be brought back to her room. And that is all. Thank you.